This is the Emergency Medical Minute, sponsored by Health One.
This is Ricky Dhaliwal, emergency medicine physician here at Swedish Medical Center in Denver, Colorado. Here bringing you the Medical Minute for today. Today we're going to discuss VFib arrests, refractory VFib arrests specifically, and the consideration of using beta blockade as a last-ditch effort for patients where you are unable to return ROSC, specifically using Esmolol. We have been doing this at my training site, Hennepin County Medical Center, for quite some time, and actually there was a case series that was published regarding the findings of this. The idea being, after multiple rounds of epinephrine, amiodarone, and shocks, using Esmolol as your last-ditch effort. The concept is specifically related to the physiology, pathophysiology of what epinephrine itself does. Epinephrine, of course, stimulates alpha and beta receptors, which increases sympathetic tone and can contribute to increased myocardial oxygen consumption, myocardial dysfunction, can create new arrhythmias, and also can create an influx of calcium into the myocardial cells themselves. So blockade may counteract some of these deleterious effects of beta adrenergic stimulation caused by repeated epinephrine doses during ACLS resuscitation. The Annals of Emergency Medicine published a meta-analysis which came out in the beginning of July, and it looked at all the previous observational studies that looked at this. Of course, there's not been any RCT trials, so the data isn't the best, but it seems that the outcomes that folks were having were actually quite positive. There was one study that in 2014 that was published that showed patients who got Esmolol after usual ACLS care, about 50% of them survived versus just usual ACLS care where only 11% survived. And there was another study in Korea in 2016 which showed that Esmolol after usual care, ACLS care, had 56% survival versus 16% in usual ACLS care. So there's definitely something here to consider. So next time you have a patient with a refractory VFib arrest, after you've done 3 shocks, 3 milligrams of epinephrine, 300 milligrams of amiodarone, consider using 500 micrograms per kilogram of Esmolol in your algorithm. If you want to get even more forward thinking, consider 2 defibrillators for dual defibrillation, where you turn on and pre-charge 2 separate defibrillators with pads on the patient, along with your Esmolol bolus. Hopefully this is something that adds to your armamentarium in treating patients with refractory VFib. For a Medical Minute, thank you, and we'll see you next time.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.